Bismillah wa salatu wassalamu ala rasulillah wa ala alihi wa sahbihi ajma'in. Welcome to this demonstration session. I'm Tariq Madani, Professor of Medicine and Infectious Diseases and Chairman of the Section of Infectious Diseases and Chairman of the Infection Control and Environmental Health Unit at King Abdulaziz University. I'll just introduce what our unit is doing, and then we'll be talking about how to don and doff the personal protective equipment as mentioned in my lecture in section 1. The infection control unit is meant to prevent infections among patients, healthcare workers, and visitors. In our hospital, the infection control unit is divided into two main activities. The infection control aspect, which deals with surveillance for hospital-acquired infections such as ventilator-associated pneumonia, central line-associated bloodstream infection, Foley's catheter-related urinary tract infection, and surgical site infection. So we do surveillance for these infections to make sure that they are not out of the expected incidence. We also do auditing to make sure that people are following our standards of infection control in terms of hand hygiene auditing, and we also do CSSD, Central Sterile Supply Department auditing, where we ensure that equipment are properly sterilized. We also assess the knowledge, attitude, and practice of workers in following the infection control standards. We also deal with the notification of infections to the Ministry of Health to report all communicable diseases to the Ministry of Health. The other activity of the infection control deals with the environmental health, and we have many subunits under this activity. We have the waste management, which we'll talk about in some details, and we have the pest control to make sure that no animals, insects in the hospital, and we have the housekeeping to ensure that the environment is properly cleaned, and we have the laundry to make sure that the linens, gowns that are not disposable, and all other non-disposable clothes are properly cleaned. And we also have food and water safety to make sure that the food and water supplied to patients and workers in the hospital is safe. And we have also air quality monitoring to make sure that the air in the hospital is properly cleaned and filtered. And we also have a unit that deals with construction and renovation to make sure that no hazards occur when instructions and renovations are undergoing in the hospital.